Hi, my name is Kaylee, and my presentation today is on Vyvanse, which is an amphetamine. So what is Vyvanse? Vyvanse is a stimulant used to treat ADHD. It is also used to treat certain eating disorders such as binge eating. Here's a picture of Vyvanse in the top right of the screen, and then in the middle of the screen it's giving you comparisons between Adderall and Vyvanse. They're both stimulants for the central nervous system. They both give you dopamine, norepinephrine, and they have extended release formulas. And they're also both Schedule II drugs. Vyvanse, however, it contains lisdexamphetamine, prodrug. There's chewable versions of it. It's smooth and it's patented. Issues with the drug. So it can cause serious cardiovascular reactions, which means just like serious heart conditions or serious potential to have a heart attack. It can increase blood pressure or heart rate increases. My experience, the reason why I wanted to do this presentation is because I have taken Vyvanse in the past to treat my ADHD, and I was actually taken off of Vyvanse due to my heart rate increasing to such a level that it caused concern. There is also a potential to suppress growth. So if a child or someone who is not done fully developing yet starts taking Vyvanse at a younger age, it could cause a potential for their growth to be stunted, I guess, in a way. And then there's a such thing as serotonin syndrome. Serotonin syndrome is basically just like an increase of serotonin, which can cause potential hallucinations, delirium, and maybe even send someone into a coma. There's also potential for tremors, seizures, gastrointestinal symptoms, and then incoordination. Gastrointestinal symptoms might include something like diarrhea or nausea, abdominal pain, and even decreased appetite, which is why sometimes the medication is used to treat mild to severe binge eating disorders in adults. There's a potential to abuse the drug. Vyvanse is not as strong as Adderall, but there is a potential to abuse it still. For people who don't suffer with ADHD and take these kinds of drugs, there's an increased ability to do things, maybe multitask, feel like they can do more, and it gives them energy boosts. So that might be a reason why people who don't actually need the medication take it, especially you hear more about it in college, like college students taking Adderall or Vyvanse to stay awake during exam times, and so that way they can get more studying in and just focus up. And then here's another comparison between Vyvanse and Adderall. So for Vyvanse, right here on this side, there's a slower absorption rate, which it starts working after 1 to 2 hours. Its effects last for 14 hours. There's a lower risk of abuse because it cannot be inhaled or injected. And the generic just means that Adderall has had a generic brand or medication available for a long time now, and Vyvanse is now generic as well. They have a generic version of it as well. Adderall is faster to absorb. Its effects last for 4 hours for the regular Adderall, and then for the prescription grade Adderall, the higher dosage, I should say, lasts 10 to 12. There is more potential for abuse because it's easier to get, and it's also just more effective, if that makes sense. And that's my presentation. Thank you for watching and listening.